When a patient requests an implant, there's always a question. Shall the implant can be loaded? Shall the implant, can we put something on top? Well, imagine that you placed it inside the bone, you just had a recent surgery and you're gonna put it to work? That's not the best way. That's not the best way. One of the things that I tell my patients is that once we put the implant, let it heal. Let that process, because remember that we put those implants inside the bone and there's going to be obviously a mechanical interaction between the implant and the bone, but there's also a chemical, because now it comes the body acceptance. So one of the recommendations is not to load them. There's only just certain protocols where they can be immediate load, like the all-on-4 or snapping dentures. That's another story. But regular implants, you put the implant, you put the cover screw, and you just wait. At least 3 months for the recovery. That will depend on the patient's age and also on the bone condition. And afterwards, you just remove the cover screw and you can place abutment and crown. What's gonna happen meanwhile? Because the question is, can we put a flipper there? Yes, you can use a removable flipper. We don't recommend to have a temporary crown placed or screwed on top of that implant. Why? Because all that vibration, that tooth, it doesn't matter if it's temporary, that masticatory forces are gonna be directly to the implant. And you don't wanna harm more that area. You just had a recent surgery there, leave it alone. If you put a flipper, the flipper is not going to be touching on direct contact with the implant. So that's the best way to go. You can certainly put an implant, you can put a flipper, and it could be a successful story. Two-stage implant are the most classical way to go, but you're going to find great results. Thank you.